On the 7th of May 2013 at Muksudpur Hospital, Gopalganj, the father of a patient had an argument with the hospital's office assistant Ram Prasad Chakraborty over irregularities in the treatment system of the hospital. On the 7th of June 2013, office assistant Ram Prasad Chakraborty filed a case in the name of the patient's father as the plaintiff. It is mentioned in the statement, after the patient was taken to the emergency department, the duty medical officer Drive. Naloy Ranjan Vallabh, Deputy Assistant Community Medical Officer Suman Saha and Ram Prasad Chakraborty arranged to start the treatment of the patient. Note that the plaintiff in the case admitted that he did not file the case. The Health and Family Planning Officer of the hospital gave him the case. The plaintiff did what the Health and Family Planning Officer told him. It is a false case filed against the will and ignorance of the plaintiff. Why Family Planning Officer Drive? Ryan Saban was not the plaintiff in this case instead of Ram Prasad Chakraborty. It is not understandable, as he forced the plaintiff to file the suit against the plaintiff's reluctance. According to the hospital's CCTV footage and eyewitness accounts, Drive. Suman Saha was not present, but the statement said Dr. Naloy Ranjan Vallabh, Drive. Suman Saha and Ram Prasad Chakraborty administered first aid. If Suman Saha is present, why is he not in the video? Dr. Naloy Ranjan Vallabh came after giving oxygen. The video footage shows that office assistant Ram Prasad Chakraborty gave oxygen to the patient in violation of all the rules of the medical system. An office assistant can never provide healthcare to any patient, because, if oxygen is not given properly, the patient may die. The patient's father had an argument with Ram Prasad Chakraborty over giving oxygen. Because, the patient's father knew, no peon or office assistant can give oxygen to a patient. It's not their job. But Ram Prasad Chakraborty engages in an argument with the patient's father without heeding any words of the patient's father. The issues related to providing oxygen services in hospitals are: providing oxygen services to patients in government hospitals is an important task. Patients may need oxygen to maintain healthcare, while they may have shortness of breath or respiratory problems. Proper treatment and care of them is essential. Following are some of the functions of providing oxygen services in government hospitals. Oxygen supply. Adequate requirements are formulated to ensure oxygen supply in government hospitals. It depends on the government officials and the hospital administration. Situational assessment. Situational assessment is done to determine the position of the patient and the need for oxygen services. Sufficient information is collected to provide the correct amount of oxygen for service. Oxygen supply and flow. Necessary equipment is procured in a suitable way to supply oxygen. It may include oxygen cylinders, oxygen concentrators, oxygen pipelines, etc. Oxygen training. Health workers are given the necessary training so that they know the proper procedures for oxygen delivery and can provide care safely. Oxygen monitoring and management. Patients are monitored by monitoring their oxygen levels, so that they can be increased or decreased as needed. Administering the correct dose. The amount of oxygen required by the patients is determined and that amount of oxygen is administered. Most doctors prescribe that dosage depending on the situation. Accurate data recording. While providing oxygen services to patients, the quantity, status and other basic information of oxygen delivered is accurately recorded. Emergency services. In critical situations, patients are provided with emergency oxygen services to save their lives. By undertaking all these activities, government hospitals provide proper and safe oxygen services to patients and ensure their health. Who is responsible for giving oxygen to patients in government hospitals? Various officials may have responsibility for providing oxygen services to patients in government hospitals, and it depends on the adequacy of local hospital institutions and government administration. These responsibilities may include some of the following professional and administrative enhancements. Physician or doctor. A physician or doctor prescribes the prescribed amount of oxygen to assess the condition of the patients and provide adequate oxygen service. Nurses are healthcare providers. Nurses or other healthcare providers help provide oxygen services and ensure proper care of patients. Medical technologists. Medical technologists work in oxygen monitoring and providing services in, if necessary, making necessary changes. Hospital administration and paramedical staff. Hospital administration and paramedical staff help in formulating oxygen service delivery policies and follow government guidelines. Health administrative officers. Health administrative officers in government hospitals provide guidance on proper situation assessment and oxygen supply protocols. The cooperation of these various professional and administrative officials is necessary to provide accurate and safe oxygen services to patients. In the light of these issues, no office assistant can provide oxygen services to patients. The plaintiff in the case has admitted that Dr. Niloy Ranjan Vallabh, Deputy Assistant Community Medical Officer Suman Saha and Dr. Ryan Chauvin asked him to give him oxygen, but the video footage shows that Ram Prasad Chakraborty administered oxygen to the patient without a moment's delay. Then none other than the plaintiff Ram Prasad Chakraborty was present. The plaintiff realized his mistake and did not want to file the case, but he was forced to file the case at the instigation of Dr. Ryan Chauvin. His conversation is recorded in the video. The question is, if the duty medical officer Drive. Niloy Ranjan Vallabh, Deputy Assistant Community Medical Officer Suman Saha and Dr. Ryan Chauvin were present, how could an office assistant provide important healthcare services like giving oxygen to the patient, whether oxygen would be given by doctors or nurses? The attached video details who can give oxygen to a patient. I am drawing the attention of the administration to take appropriate disciplinary action against Drive. Suman Saha, Drive. Ryan Chauvin and Ram Prasad Chakraborty for violating the rules of the medical system.